Question 1. The audit findings indicate a significant and recurring pattern of patient complaints related to perceived disrespect and misunderstanding of cultural beliefs during clinical encounters across several departments. As a physician executive, what is the most appropriate strategic response to address this systemic issue? Option A. Implement a comprehensive, organization-wide cultural competence training program for all clinical staff, integrated into ongoing professional development, and revise organizational policies to explicitly incorporate cultural humility and patient-centered communication principles. Option B. Mandate the translation of all patient education materials into the top 5 most common languages spoken by the patient population. Option C. Instruct department managers to address individual staff members who receive complaints, focusing on their personal communication styles. Option D. Conduct a series of one-off diversity and inclusion workshops for all staff, focusing on general awareness of different cultural groups. Correct answer is A. Implement a comprehensive, organization-wide cultural competence training program for all clinical staff, integrated into ongoing professional development, and revise organizational policies to explicitly incorporate cultural humility and patient-centered communication principles. Explanation. The audit findings indicate a persistent gap in physician executive understanding and application of culturally competent care within a diverse patient population. This scenario is professionally challenging because it directly impacts patient safety, quality of care, and health equity, all core responsibilities of a physician executive. Failure to address cultural competence can lead to misdiagnosis, non-adherence to treatment plans, patient dissatisfaction, and ultimately, poorer health outcomes. The physician executive must navigate not only the clinical implications, but also the ethical and regulatory imperatives to provide equitable care. The correct approach represents best professional practice because it prioritizes a systemic, data-driven, and integrated strategy for enhancing cultural competence. This involves understanding the specific cultural needs of the patient population, developing targeted educational programs for the medical staff, and embedding cultural competence into organizational policies and performance metrics. This proactive and comprehensive strategy aligns with the ethical obligation to provide non-discriminatory care and the regulatory expectation for healthcare organizations to address health disparities. It fosters an environment where all patients feel respected and understood, leading to improved engagement and outcomes. An incorrect approach that focuses solely on a one-time diversity training session is professionally unacceptable. This fails to address the systemic nature of cultural competence, which requires ongoing learning and integration into daily practice. It is a superficial solution that does not equip staff with the nuanced skills needed to adapt care to diverse patient backgrounds. Ethically, it falls short of the commitment to continuous improvement in patient care. Another incorrect approach that involves simply updating patient-facing materials to include multiple languages is also insufficient. While important, this addresses only a communication barrier and does not tackle the underlying attitudinal or knowledge gaps related to cultural understanding among healthcare providers. It neglects the crucial aspect of provider-patient interaction and the impact of cultural beliefs on health behaviors. Regulatory frameworks emphasize a broader approach to cultural competence that encompasses provider education and organizational commitment. Finally, an approach that dismisses the audit findings as a minor issue or a matter of individual provider preference is a severe ethical and professional failure. This demonstrates a lack of leadership accountability and a disregard for patient well-being and organizational responsibility. It actively undermines efforts to achieve health equity and can lead to significant legal and reputational risks for the organization. Physician executives are mandated to champion quality improvement and ensure that all patients receive appropriate and respectful care, irrespective of their cultural background. The professional reasoning process for similar situations should involve a thorough assessment of the audit findings, identification of specific areas of deficiency, and the development of a multifaceted action plan. This plan should be grounded in evidence-based practices for cultural competence, involve stakeholder engagement, including patients and staff, and include mechanisms for ongoing monitoring and evaluation. Physician executives must lead by example, advocating for resources and policies that support a culturally competent healthcare environment. Question 2. Regulatory review indicates that a physician executive is tasked with developing the annual operating budget for a large healthcare system. The executive must consider input from various departments, including clinical services, research, and administration, while ensuring the budget supports the organization's strategic objectives and maintains financial viability. Which of the following approaches best aligns with best professional practice and regulatory expectations for physician executive budgeting and financial planning? Option A. Develop the budget by analyzing historical spending patterns for each department and making incremental adjustments based on projected inflation and anticipated revenue changes, with minimal direct consultation with clinical department heads to expedite the process. Option B. Initiate a collaborative budgeting process that involves soliciting detailed financial needs and strategic priorities from all clinical and administrative departments, analyzing these requests against projected revenue and organizational goals, and presenting a transparent, data-driven budget proposal that clearly links resource allocation to patient care outcomes and operational efficiency. Option C. Implement a budget based primarily on achieving a predetermined profit margin, making across-the-board percentage cuts to departmental budgets that do not meet initial financial targets, regardless of their specific operational needs or impact on patient care. Option D. Focus the budget solely on capital expenditures for new technology and infrastructure upgrades, deferring operational expenses and staffing adjustments to a separate, less formal review process to maintain flexibility. The correct answer is A. Develop the budget by analyzing historical spending patterns for each department and making incremental adjustments based on projected inflation and anticipated revenue changes, with minimal direct consultation with clinical department heads to expedite the process. Explanation: this scenario presents a common challenge for physician executives, balancing the financial realities of healthcare operations with the clinical needs and expectations of various stakeholders. The core tension lies in allocating limited resources effectively to achieve both fiscal sustainability and optimal patient care outcomes. The physician executive must navigate competing priorities, understand the financial implications of clinical decisions, and communicate financial plans transparently to build trust and secure buy-in. The correct approach emphasizes a collaborative and data-driven process that aligns financial planning with strategic clinical goals. By involving key stakeholders, including clinical leaders, department heads, and finance professionals, the physician executive ensures that the budget reflects actual operational needs and clinical priorities. This inclusive method fosters a shared understanding of financial constraints and opportunities, leading to more realistic and achievable financial targets. Furthermore, grounding the budget in evidence-based practices and projected patient volumes ensures that resource allocation directly supports quality patient care and operational efficiency, aligning with the ethical imperative to provide high-quality health care. This approach also promotes accountability and transparency, crucial elements in maintaining stakeholder confidence and regulatory compliance. An incorrect approach that solely focuses on historical spending, without considering current clinical needs or future strategic initiatives, fails to adapt to the evolving healthcare landscape. This can lead to underfunding critical services or overspending on outdated practices, ultimately compromising patient care and organizational financial health. Such an approach may also alienate clinical staff who feel their needs are not being heard or addressed, leading to decreased morale and potential resistance to financial directives. Another incorrect approach that prioritizes short-term cost reduction over long-term value creation can have detrimental effects. While immediate savings might appear attractive, they can lead to a decline in the quality of care, increased patient dissatisfaction, and ultimately higher costs in the long run due to complications or readmissions. This approach often neglects the importance of investing in technology, staff development, or preventative care, which are essential for sustainable success in healthcare. Ethically, this can be viewed as a failure to uphold the duty of care to patients. A third incorrect approach that relies on arbitrary cuts or across-the-board reductions without a clear rationale or impact assessment is unprofessional and potentially harmful. This method ignores the unique financial drivers and clinical demands of different departments, leading to inequitable resource distribution and potential disruption of essential services. It lacks the strategic foresight and analytical rigor expected of a physician executive and can erode trust among staff who perceive the decisions as uninformed and lacking in clinical understanding. The professional decision-making process for physician executives in budgeting and financial planning should involve a systematic approach. 1. Understand the organization's strategic goals and clinical mission. 2. Gather input from all relevant stakeholders, including clinical departments, finance, and administration. 3. Analyze historical financial data and current operational needs. 4. Develop financial projections based on evidence-based practices, anticipated patient volumes, and market trends. 5. Prioritize resource allocation based on impact on patient care quality, safety, and organizational sustainability. 6. Communicate the budget clearly and transparently to all stakeholders, explaining the rationale behind decisions. 7. Establish mechanisms for ongoing monitoring, evaluation, and adjustment of the budget. Question 3. Stakeholder feedback indicates a proposed federal healthcare policy change in the CPE jurisdiction that could significantly alter reimbursement models for chronic disease management. As a physician executive, what is the most appropriate initial step to assess the potential impact on your organization and its patient population? Option A. Convene a task force comprising clinical leaders, financial analysts, and legal counsel to conduct a comprehensive impact assessment, analyzing potential changes to patient care pathways, operational workflows, financial viability, and compliance requirements, while consulting relevant federal regulations and guidance. Option B. Rely on informal discussions with industry peers and review general healthcare news articles to gauge the likely severity of the policy change and its potential effects. Option C. Immediately implement new patient education materials focused on self-management, assuming the policy change will necessitate a greater emphasis on patient-driven care, without a formal assessment of the reimbursement shifts. Option D. Focus solely on the potential reduction in revenue, instructing the finance department to model worst-case financial scenarios without considering the broader implications for patient care delivery or regulatory compliance. The correct answer is A. Convene a task force comprising clinical leaders, financial analysts, and legal counsel to conduct a comprehensive impact assessment, analyzing potential changes to patient care pathways, operational workflows, financial viability, and compliance requirements, while consulting relevant federal regulations and guidance. Explanation. This scenario presents a common challenge for physician executives, balancing the operational needs of a healthcare organization with the complex and evolving landscape of healthcare policy and regulation. The core difficulty lies in anticipating the downstream effects of proposed legislative changes on patient care, organizational resources, and physician practice patterns, all while ensuring compliance with the Physician Executive Certification (CPE) jurisdiction-specific regulatory framework. Careful judgment is required to move beyond superficial understanding and conduct a thorough impact assessment that considers multiple stakeholder perspectives and potential unintended consequences. The correct approach involves a proactive and comprehensive analysis of the proposed legislation's implications. This includes identifying all affected parties, patients, physicians, administrators, payers, etc., evaluating potential changes to service delivery models, assessing financial impacts, and determining necessary adjustments to internal policies and procedures. Crucially, it requires consulting relevant regulatory guidance and legal counsel to ensure accurate interpretation and adherence to the CPE jurisdiction's laws. This approach represents best professional practice because it prioritizes informed decision-making, risk mitigation, and strategic adaptation, thereby safeguarding the organization's compliance status and its ability to provide quality patient care within the established legal and ethical boundaries. An incorrect approach would be to dismiss the proposed legislation as unlikely to pass, or to focus solely on the most immediate and obvious operational impacts without considering broader regulatory implications. Failure to conduct a thorough impact assessment can lead to significant compliance breaches, financial penalties, and disruptions to patient care. Another incorrect approach is to rely on anecdotal evidence or the opinions of a limited group of stakeholders without rigorous analysis. This can result in decisions based on incomplete or biased information, leading to misinterpretations of regulatory intent and potential violations. Furthermore, an approach that prioritizes short-term cost savings over long-term regulatory adherence is fundamentally flawed, as it ignores the severe repercussions of noncompliance. Professionals should employ a structured decision-making process that begins with a clear understanding of the proposed policy or regulation. This involves identifying the specific regulatory body and the relevant statutes or guidelines within the CPE jurisdiction. Next, a multidisciplinary team should be assembled to conduct a comprehensive impact assessment, considering clinical, financial, operational, and legal dimensions. This assessment should involve scenario planning and risk analysis. Finally, decisions should be informed by this analysis, with a clear rationale documented, and appropriate consultation with legal and compliance experts sought before implementation. Question 4. The control framework reveals that Dr. Anya Sharma, a physician executive overseeing a critical quality improvement initiative, has a team of physicians with varying levels of experience and engagement with the project's complex data analysis requirements. Some team members are highly skilled but overwhelmed, while others are eager but lack the specific analytical expertise. Dr. Sharma needs to ensure the initiative's timely and accurate completion while fostering team growth, considering the principles of situational leadership and the regulatory imperative for accurate quality reporting. Which leadership approach would be most effective in this scenario? Option A. Implement a coaching leadership style, providing individualized guidance and support to team members, encouraging them to take ownership while developing their analytical skills. Option B. Utilize a delegating leadership style, assigning specific analytical tasks to individuals based on their perceived strengths, with minimal oversight. Option C. Employ a laissez-faire leadership style, allowing team members to independently determine their own approaches and timelines for data analysis. Option D. Adopt an autocratic leadership style, dictating specific analytical methods and timelines to ensure immediate compliance and task completion. Correct answer is A. Implement a coaching leadership style, providing individualized guidance and support to team members, encouraging them to take ownership while developing their analytical skills. Explanation: this scenario presents a common challenge in healthcare leadership, balancing the need for immediate task completion with the long-term development of a team. Dr. Anya Sharma, as a physician executive, must navigate the complexities of situational leadership to effectively manage her team and ensure optimal patient care outcomes. The challenge lies in recognizing that different team members require different leadership styles based on their competence and commitment to specific tasks. A one-size-fits-all approach is unlikely to be effective and could lead to decreased morale, underperformance, and potential compliance issues if critical tasks are not executed correctly. The correct approach, adopting a coaching leadership style, represents best professional practice because it aligns with the principles of developing physician leaders and fostering a culture of continuous improvement. Coaching involves providing guidance, support, and opportunities for skill development, empowering individuals to take ownership of their work. This style is particularly effective when team members have some competence but may lack full confidence or commitment. By investing in their development, Dr. Sharma can build a more resilient and capable team, ultimately enhancing the organization's ability to meet its strategic objectives and adhere to regulatory requirements for quality patient care and operational efficiency. This approach also supports ethical obligations to foster professional growth and ensure competent performance within the healthcare team. An autocratic leadership style, while potentially delivering quick results, fails to foster autonomy and can lead to resentment and disengagement, potentially impacting the quality of care and adherence to protocols. This approach neglects the ethical imperative to empower and develop staff. A laissez-faire approach, characterized by a lack of direction and support, would be a significant failure in a regulated environment like healthcare. It risks critical tasks being overlooked or performed incorrectly, leading to direct violations of patient safety regulations and quality standards. Furthermore, it demonstrates a lack of leadership accountability. A delegating approach, while valuable, might be premature if the team members are not yet fully equipped with the necessary skills or confidence, potentially leading to errors and noncompliance. This would represent a failure to adequately assess team readiness and provide appropriate support, which is an ethical and professional failing in leadership. Professionals should employ a decision-making process that begins with a thorough assessment of the team's current capabilities, motivation, and the specific demands of the task. This involves understanding the principles of situational leadership, which posits that effective leaders adapt their style to the readiness level of their followers. The process should then involve selecting the leadership style that best matches this assessment, with a bias towards developmental approaches like coaching or supporting when appropriate. Regular feedback, clear communication of expectations, and a commitment to ongoing team development are crucial components of this process, ensuring both task accomplishment and the cultivation of a high-performing, compliant team. Question 5. Implementation of a new cost-saving initiative within a community hospital requires a physician executive to evaluate potential service line reductions. The executive must consider the ethical implications of discontinuing services that are disproportionately utilized by low-income and uninsured patients, while also addressing significant operational deficits. Which of the following approaches best balances ethical obligations with financial realities? Option A. Implement across-the-board percentage cuts to all service lines, including those critical for vulnerable populations, to distribute the financial burden evenly without specific consideration for patient impact. Option B. Focus solely on eliminating services with the highest operational costs, regardless of their essential nature or the patient demographics they serve, to maximize immediate financial savings. Option C. Conduct a thorough analysis of alternative cost-saving measures across all departments. Engage in transparent dialogue with community stakeholders and patient advocacy groups to explore collaborative solutions, and advocate for increased public funding or grants to sustain essential services before considering any service reductions. Option D. Immediately suspend the least profitable service lines that have the highest utilization by vulnerable patient populations to achieve rapid financial stabilization, with a plan to reintroduce services if future profitability allows. The correct answer is C. Conduct a thorough analysis of alternative cost-saving measures across all departments. Engage in transparent dialogue with community stakeholders and patient advocacy groups to explore collaborative solutions, and advocate for increased public funding or grants to sustain essential services before considering any service reduction. Explanation. The scenario presents a common ethical dilemma in healthcare leadership, balancing the financial viability of a healthcare organization with the ethical imperative to provide equitable access to care, particularly for vulnerable populations. Physician executives are tasked with making decisions that impact patient outcomes, staff morale, and organizational sustainability. The challenge lies in navigating competing interests and ensuring that decisions align with professional ethical standards and relevant regulatory frameworks. The correct approach prioritizes patient well-being and equitable access to care, even when faced with financial pressures. This aligns with core ethical principles such as beneficence, acting in the patient's best interest, and justice, fair distribution of resources and access to care. Regulatory frameworks, such as those governing nonprofit healthcare organizations and patient rights, often mandate a commitment to serving the community and avoiding discriminatory practices. A physician executive demonstrating best professional practice would engage in transparent communication, explore all viable alternatives to service reduction, and advocate for resources that support continued access to essential services. An incorrect approach that focuses solely on immediate financial gains without considering the impact on patient access or community needs would represent a failure to uphold ethical obligations. This could lead to regulatory violations if it results in discriminatory practices or a failure to meet community benefit requirements. Another incorrect approach that involves unilateral decision-making without stakeholder input or consideration of ethical implications undermines trust and can lead to poor outcomes. This demonstrates a lack of due diligence and a disregard for collaborative governance principles. A third incorrect approach that prioritizes the interests of a select group over the broader patient population or community violates the principle of justice and can lead to significant ethical and legal repercussions. Professionals should employ a decision-making process that begins with identifying the ethical dimensions of the situation, consulting relevant professional codes of conduct and regulatory guidelines, engaging stakeholders, including patients, staff, and community representatives, exploring all feasible alternatives, and documenting the rationale for the chosen course of action. This systematic approach ensures that decisions are not only financially sound, but also ethically defensible and legally compliant. Question 6. Quality control measures reveal that a significant portion of physicians are expressing resistance to the upcoming implementation of a new electronic health record system citing concerns about workflow disruption and increased administrative burden. As a physician executive overseeing this initiative, which of the following approaches best aligns with best practices in change management for healthcare organizations? Option A. Conduct a series of town hall meetings to inform physicians about the EHR's features and benefits, without actively soliciting or incorporating their specific workflow concerns into the implementation plan. Option B. Establish a physician advisory committee composed of respected clinical leaders to co-design workflow integration strategies, provide tailored training based on specialty needs, and create a continuous feedback loop for post-implementation adjustments. Option C. Mandate immediate adoption of the new EHR system with a clear timeline for compliance, offering only basic IT support and general training sessions for all clinical staff. Option D. Proceed with the EHR implementation as planned, focusing primarily on the technical aspects and assuming that physicians will adapt over time with minimal direct intervention. The correct answer is B. Establish a physician advisory committee composed of respected clinical leaders to co-design workflow integration strategies, provide tailored training based on specialty needs, and create a continuous feedback loop for post-implementation adjustments. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare leadership or a significant organizational change. The implementation of a new electronic health record (EHR) system is met with resistance from a key stakeholder group, physicians. The challenge lies in balancing the strategic imperative of technological advancement with the practical realities of physician workflow, adoption, and potential impact on patient care. Physician buy-in is critical for successful EHR implementation, as their active participation and proficiency directly influence data quality, efficiency, and patient safety. Failure to address their concerns effectively can lead to suboptimal system utilization, increased administrative burden, and ultimately, a failure to realize the intended benefits of the EHR. Correct approach analysis. The most effective approach involves a structured, physician-centric change management strategy that prioritizes communication, education, and engagement. This aligns with best practices in organizational change, emphasizing stakeholder involvement and addressing concerns proactively. Specifically, involving physician champions in the design and rollout phases, providing comprehensive and tailored training, and establishing clear feedback mechanisms are crucial. This approach fosters a sense of ownership and collaboration, mitigating resistance by demonstrating that physician input is valued and integrated into the process. It also supports the ethical obligation to ensure that technological changes do not negatively impact patient care, by ensuring physicians are adequately prepared and supported. Incorrect approaches analysis. One incorrect approach is to proceed with the EHR implementation with minimal physician input, relying solely on top-down directives and assuming compliance. This approach fails to acknowledge the expertise and operational realities of physicians, leading to potential workflow disruptions, frustration, and ultimately, poor adoption. Ethically, it risks compromising patient care if physicians are unable to effectively use the system due to inadequate training or unaddressed workflow concerns. It also violates principles of professional respect and collaboration. Another incorrect approach is to offer superficial engagement, such as one-off informational sessions without genuine opportunities for feedback or influence. While appearing to address the need for communication, this approach lacks substance and can be perceived as disingenuous by physicians, further exacerbating resistance. It fails to build trust and can lead to a perception that their concerns are not being taken seriously, undermining the change initiative. A third incorrect approach is to focus solely on the technical aspects of the EHR, neglecting the human element of change. This might involve extensive IT support but insufficient attention to how the EHR will alter physician workflows, communication patterns, and their relationship with patients. This overlooks the critical impact on physician satisfaction and burnout, which can indirectly affect patient care and organizational performance. Professional reasoning. When faced with significant organizational change impacting clinical practice, a physician executive must employ a systematic and empathetic change management framework. This involves 1. Understanding the current state and identifying potential barriers to change, particularly from the perspective of those directly affected. 2. Developing a clear vision for the change and communicating its benefits effectively, linking it to improved patient outcomes and organizational goals. 3. Engaging key stakeholders, especially physician leaders and end users, early and often in the planning and implementation process. 4. Providing adequate resources, including comprehensive training, ongoing support, and opportunities for feedback and iterative improvement. 5. Establishing metrics to evaluate the success of the change and making adjustments as needed. This process ensures that change is not only implemented, but also sustained and contributes positively to the organization's mission. Question 7. Cost-benefit analysis shows that implementing a new electronic health record (EHR) system with advanced patient data analytics capabilities will significantly improve care coordination and reduce medical errors, but also requires substantial upfront investment and ongoing staff training to ensure compliance with federal and state privacy and security regulations. As a physician executive, what is the most appropriate approach to navigate this implementation challenge? Option A. Proceed with the EHR implementation, focusing primarily on cost containment by selecting the most affordable vendor and minimizing staff training to only essential functions, assuming that general IT security measures will suffice for regulatory compliance. Option B. Delegate the entire responsibility for regulatory compliance related to the EHR to the IT department, trusting their general knowledge of data security to meet all federal and state mandates without direct physician, executive oversight, or involvement in the compliance strategy. Option C. Prioritize the EHR implementation by allocating sufficient budget for robust training and engaging legal and compliance experts early to ensure all federal and state regulatory requirements, including HIPAA and relevant state-specific privacy laws, are fully integrated into the system's design and operational protocols. Option D. Delay the EHR implementation indefinitely until a clearer understanding of all potential federal and state regulatory nuances can be achieved, to avoid any possibility of non-compliance, even if it means foregoing immediate improvements in patient care. Correct answer is C. Prioritize the EHR implementation by allocating sufficient budget for robust training and engaging legal and compliance experts early to ensure all federal and state regulatory requirements, including HIPAA and relevant state-specific privacy laws, are fully integrated into the system's design and operational protocols. Explanation. This scenario presents a common implementation challenge for physician executives, balancing the imperative to comply with federal and state regulations with the practical realities of resource allocation and operational efficiency. The challenge lies in identifying and mitigating risks associated with noncompliance, which can range from financial penalties to reputational damage and even patient harm. A physician executive must navigate the complexities of differing regulatory requirements, interpret their implications for clinical practice and administrative processes, and develop strategies that are both compliant and sustainable. The correct approach represents best professional practice because it prioritizes a thorough understanding of the regulatory landscape and its direct impact on the organization's operations and patient care. It involves proactive engagement with legal and compliance experts to ensure accurate interpretation and implementation of federal and state mandates. This approach fosters a culture of compliance, minimizes legal and financial risks, and ultimately supports the delivery of safe and effective patient care, aligning with the core ethical and professional responsibilities of a physician executive. An incorrect approach that focuses solely on cost reduction without adequate consideration for regulatory requirements is professionally unacceptable. This failure stems from a disregard for the legal obligations imposed by federal and state laws, such as HIPAA for patient privacy or Stark law for physician self-referral. Such an approach risks significant financial penalties, civil lawsuits, and potential exclusion from federal healthcare programs. Another incorrect approach that relies on outdated or incomplete information about regulations is equally problematic. This can lead to unintentional noncompliance, exposing the organization to penalties and compromising patient safety. Furthermore, an approach that delegates regulatory oversight entirely to non-clinical staff without physician executive involvement overlooks the critical role of clinical leadership in ensuring that regulatory requirements are translated into effective patient care practices. This can result in a disconnect between policy and practice, leading to compliance gaps and potential patient harm. The professional decision-making process for similar situations should involve a systematic risk assessment. This includes identifying all applicable federal and state regulations, understanding their specific requirements, and evaluating the potential impact of noncompliance on the organization and its patients. It necessitates collaboration with legal counsel, compliance officers, and relevant department heads. The physician executive should then develop a phased implementation plan that prioritizes high-risk areas, allocates necessary resources, and establishes clear metrics for monitoring and evaluating compliance. Regular training and ongoing communication are essential to ensure that all staff members understand their roles and responsibilities in maintaining regulatory adherence. Question 8. Operational review demonstrates persistent inefficiencies in the surgical unit's workflow, with anecdotal evidence suggesting significant interpersonal friction and communication breakdown among the surgical team members, impacting turnaround times and potentially patient safety. As the physician executive responsible for this unit's performance, what is the most effective approach to optimize team dynamics and improve operational processes? Option A. Encourage informal peer-to-peer mediation sessions to allow team members to resolve their differences organically. Option B. Conduct confidential, individual interviews with each team member to gather perspectives on team dynamics and identify specific areas of conflict or inefficiency, followed by a facilitated team meeting to collaboratively develop and implement targeted strategies for improvement. Option C. Directly address the perceived conflicts by issuing a directive outlining expected professional conduct and communication protocols, without further team consultation. Option D. Implement a new performance management system that strictly enforces individual accountability for turnaround times, with clear consequences for any delays, to incentivize better individual performance. The correct answer is B. Conduct confidential, individual interviews with each team member to gather perspectives on team dynamics and identify specific areas of conflict or inefficiency, followed by a facilitated team meeting to collaboratively develop and implement targeted strategies for improvement. Explanation. This scenario presents a common challenge in healthcare leadership, optimizing team dynamics to improve operational efficiency and patient care outcomes. The physician executive must navigate interpersonal conflicts and differing communication styles within a clinical team to foster collaboration and achieve strategic goals. The challenge lies in balancing individual needs and professional relationships with the overarching mandate for process optimization and adherence to regulatory standards. The correct approach emphasizes a structured, data-driven, and inclusive method to address team dynamics. By initiating a confidential assessment and facilitating open dialogue, the physician executive can identify root causes of friction and collaboratively develop solutions. This aligns with principles of effective leadership and quality improvement, which are central to physician executive certification. It promotes a culture of continuous improvement and ensures that team interventions are evidence-based and tailored to the specific context, thereby enhancing patient safety and operational effectiveness, which are implicitly governed by healthcare regulations focused on quality of care and efficient resource utilization. An incorrect approach that focuses solely on individual performance metrics without addressing underlying team dynamics fails to recognize the systemic nature of the problem. This can lead to resentment, further disengagement, and a superficial resolution that does not improve overall team functioning. It may also inadvertently violate ethical obligations to foster a supportive work environment. Another incorrect approach that involves imposing solutions without team input bypasses crucial collaborative processes. This can alienate team members, undermine trust, and lead to resistance, ultimately hindering process optimization. Such an approach neglects the importance of buy-in and shared ownership, which are critical for sustainable change, and may not align with best practices in organizational development and leadership, often implicitly supported by regulatory frameworks promoting effective governance. A third incorrect approach that relies on informal conflict resolution without a structured framework risks exacerbating the situation. Unaddressed or poorly managed conflicts can fester, leading to a toxic work environment and negatively impacting patient care. This approach lacks the rigor necessary for effective problem-solving in a regulated healthcare setting and may fail to meet standards for professional conduct and team management. The professional decision-making process for similar situations should involve a systematic assessment of the problem, considering all contributing factors, including team dynamics. The physician executive should then engage the team in a collaborative problem-solving process, utilizing evidence-based strategies for team development and conflict resolution. Transparency, clear communication, and a focus on shared goals are paramount. Adherence to ethical principles of fairness, respect, and professional responsibility should guide all interventions, ensuring that decisions are not only operationally sound, but also ethically defensible and aligned with the overarching mission of providing high-quality patient care. Question 9. Investigation of the potential impact of a proposed bundled payment initiative on a multi-specialty physician group's operational workflow, physician engagement, and long-term financial viability, considering the current regulatory landscape for value-based care in the United States. Option A. Conduct a thorough impact assessment that analyzes the initiative's alignment with organizational strategic goals, operational feasibility, potential for quality improvement, patient experience enhancement, and financial sustainability, while ensuring compliance with relevant Medicare and commercial payer regulations. Option B. Implement the bundled payment initiative immediately to capitalize on potential early adopter incentives, assuming that physician adoption will follow naturally due to the perceived benefits of value-based care. Option C. Focus exclusively on the potential for increased revenue generated by the bundled payment model, without a detailed evaluation of operational changes or quality metrics. Option D. Adopt the bundled payment initiative based on its popularity among peer organizations, without conducting an independent assessment of its suitability for the specific physician group's patient population and existing infrastructure. The correct answer is A. Conduct a thorough impact assessment that analyzes the initiative's alignment with organizational strategic goals, operational feasibility, potential for quality improvement, patient experience enhancement, and financial sustainability, while ensuring compliance with relevant Medicare and commercial payer regulations. Explanation. This scenario presents a common challenge for physician executives navigating the complexities of payment reform. The core difficulty lies in balancing the imperative to adopt new payment models that incentivize value and quality with the practical realities of operational implementation, physician buy-in, and potential financial risks. A physician executive must critically assess how a proposed payment reform initiative aligns with organizational strategy, regulatory requirements, and the ultimate goal of improving patient outcomes and cost-effectiveness. The correct approach focuses on a comprehensive, data-driven assessment of the initiative's potential impact across multiple dimensions. This includes evaluating its alignment with the organization's strategic goals, its feasibility from an operational standpoint, its potential to improve quality and patient experience, and its financial sustainability. This holistic evaluation is crucial for ensuring that the chosen initiative not only meets regulatory expectations, but also genuinely advances the organization's mission and the well-being of its patient population. It reflects best professional practice by prioritizing evidence-based decision-making and a thorough understanding of the multifaceted implications of payment reform. An incorrect approach might involve adopting a payment reform initiative solely based on its perceived popularity or a superficial understanding of its mechanics, without a rigorous assessment of its operational feasibility or alignment with organizational strategy. This could lead to significant implementation challenges, physician dissatisfaction, and a failure to achieve the intended quality or cost improvements. Another incorrect approach could be to prioritize short-term financial gains over long-term value creation and patient outcomes, which would be ethically questionable and potentially violate principles of responsible stewardship of healthcare resources. A third incorrect approach might be to disregard the specific regulatory framework governing payment reform, leading to noncompliance and potential penalties. The professional reasoning process for a physician executive in such a situation should involve 1. Clearly defining the problem and the desired outcomes of payment reform. 2. Gathering comprehensive data on potential initiatives, including their regulatory compliance, operational requirements, financial implications, and impact on quality and patient experience. 3. Engaging relevant stakeholders, including physicians, administrators, and finance teams, to solicit input and build consensus. 4. Conducting a thorough risk-benefit analysis for each viable option. 5. Selecting the initiative that best aligns with organizational strategy, regulatory requirements, and the ultimate goal of delivering high-value care. Question 10. What factors determine the most effective approach for a physician executive to ensure an organization's compliance with U.S. accreditation standards, such as those from the Joint Commission, while simultaneously optimizing patient outcomes and operational efficiency? Option A. A reactive approach that addresses compliance issues only when identified during accreditation surveys or through patient complaints, without proactive quality monitoring. Option B. A primary focus on minimizing operational costs through staff reductions and deferral of non-essential equipment upgrades, assuming accreditation standards can be met with existing resources. Option C. A comprehensive strategy that integrates data-driven quality improvement initiatives, robust staff education and engagement, and a commitment to evidence-based patient care practices. Option D. An emphasis on achieving superficial compliance by documenting adherence to protocols, without actively measuring or improving patient outcomes. The correct answer is C. A comprehensive strategy that integrates data-driven quality improvement initiatives, robust staff education and engagement, and a commitment to evidence-based patient care practices. Explanation. This scenario is professionally challenging because physician executives must balance the imperative of maintaining high-quality patient care, as mandated by accreditation standards, with the operational and financial realities of healthcare organizations. Ensuring compliance with accreditation standards, such as those set by the Joint Commission in the U.S., requires significant resources, ongoing training, and a culture of continuous improvement. Physician executives are responsible for leading these efforts, often navigating competing priorities and limited budgets. Careful judgment is required to identify and implement strategies that effectively meet accreditation requirements without compromising patient safety or organizational sustainability. The correct approach represents best professional practice because it directly addresses the core tenets of accreditation standards by focusing on evidence-based practices, patient safety initiatives, and robust quality improvement processes. This aligns with the regulatory framework's emphasis on measurable outcomes and adherence to established clinical guidelines. By prioritizing data-driven decision-making and fostering a culture of accountability, physician executives ensure that the organization not only meets but exceeds the standards, leading to improved patient outcomes and enhanced organizational reputation. This proactive and integrated approach is ethically sound and professionally responsible, fulfilling the physician executive's duty to both patients and the organization. An incorrect approach that focuses solely on cost reduction, without considering the impact on patient care or compliance, would represent a significant regulatory and ethical failure. Accreditation standards are designed to safeguard patient well-being, and any strategy that undermines this objective is unacceptable. Similarly, an approach that relies on superficial compliance measures or checking boxes without genuine commitment to quality improvement would fail to meet the spirit and intent of accreditation. This could lead to a false sense of security, masking underlying deficiencies that could jeopardize patient safety and result in sanctions or loss of accreditation. Ethically, this demonstrates a disregard for the physician executive's fiduciary duty to patients. Another incorrect approach that neglects staff training and engagement in quality initiatives would also be problematic. Accreditation standards often require demonstrated competency and active participation from all levels of staff. Failing to invest in staff development and empowerment hinders the organization's ability to sustain high standards and adapt to evolving best practices, leading to potential compliance gaps and a compromised patient experience. The professional decision-making process for similar situations should involve a comprehensive assessment of current accreditation status, identification of areas for improvement, and a thorough evaluation of potential strategies. This includes engaging key stakeholders, such as clinical staff, quality improvement teams, and administrative leadership, to gather diverse perspectives and ensure buy-in. Physician executives should then develop a strategic plan that prioritizes initiatives based on their potential impact on patient care, safety, and compliance, while also considering resource availability and organizational capacity. Continuous monitoring and evaluation of progress are essential to ensure sustained compliance and to adapt to any emerging challenges or changes in regulatory requirements. Question 11. When evaluating the impact of a newly implemented bundled payment model on a healthcare organization, which approach best demonstrates a physician executive's commitment to both patient care quality and organizational sustainability within the regulatory framework. Option A. An assessment focused exclusively on the financial savings generated by the bundled payment model. Option B. An assessment prioritizing physician satisfaction with the new payment structure. Option C. An assessment that only examines the impact on physician-led clinical teams, disregarding ancillary services. Option D. A comprehensive assessment analyzing clinical outcomes, patient experience, and financial performance metrics. The correct answer is D. A comprehensive assessment analyzing clinical outcomes, patient experience, and financial performance metrics. Explanation. Scenario analysis. A physician executive is tasked with assessing the impact of a newly implemented bundled payment model on a healthcare organization. This scenario is professionally challenging because bundled payments fundamentally alter financial incentives, shifting risk from payers to providers. The physician executive must navigate potential conflicts between clinical autonomy and financial accountability, ensuring that patient care quality is maintained or improved while achieving cost efficiencies. This requires a nuanced understanding of both clinical workflows and financial performance metrics, as well as an awareness of the regulatory landscape governing such payment models. Correct approach analysis. The most effective approach involves a comprehensive, multifaceted impact assessment that considers clinical outcomes, patient experience, and financial performance. This aligns with the Physician Executive Certification, CPE, emphasis on holistic leadership and value-based care. By analyzing data across these domains, the physician executive can identify areas of success and opportunities for improvement, ensuring that the bundled payment model is achieving its intended goals without compromising patient well-being or organizational sustainability. This approach is ethically sound as it prioritizes patient care while also addressing the financial viability of the organization, a key responsibility of a physician executive. Regulatory compliance is implicitly addressed by focusing on outcomes and efficiency, which are often key metrics in value-based care regulations. Incorrect approach is analysis. Focusing solely on financial metrics without considering clinical outcomes or patient experience is a significant regulatory and ethical failure. This approach risks incentivizing cost-cutting measures that could negatively impact patient care quality, potentially violating ethical obligations to patients and leading to non-compliance with quality reporting requirements under various healthcare regulations. It also fails to capture the full value proposition of the bundled payment model, which aims for improved outcomes at a lower cost. Prioritizing physician satisfaction above all other factors, while important for physician engagement, is an incomplete assessment. While physician buy-in is crucial for the success of any new model, an assessment that only considers this aspect neglects the core objectives of bundled payments, improving patient outcomes and managing costs. This can lead to a failure to identify systemic issues affecting patient care or financial performance, potentially resulting in regulatory scrutiny for not meeting quality or efficiency targets. Ignoring the impact on ancillary services and support staff, and focusing only on physician-led clinical teams is also problematic. Bundled payments require coordinated care across the entire patient journey, involving numerous departments and roles. An assessment that overlooks these critical components will provide an incomplete picture of the model's true impact, potentially leading to operational inefficiencies and missed opportunities for cost savings or quality improvement. This can indirectly lead to regulatory issues if overall care coordination or patient satisfaction suffers due to these oversights. Professional reasoning. Physician executives should adopt a data-driven, comprehensive approach to impact assessment. This involves establishing clear metrics for clinical quality, patient satisfaction, and financial performance before implementation. Regular monitoring and analysis of these metrics, coupled with qualitative feedback from all stakeholders, are essential. When deviations occur, a root cause analysis should be performed, considering both clinical and operational factors. This systematic process ensures that the organization remains compliant with regulations, ethically serves its patients, and achieves the strategic objectives of payment reform initiatives. Question 12. Process analysis reveals a significant bottleneck in the patient discharge process, leading to extended wait times and increased operational costs. As a physician executive, Which of the following approaches best aligns with the principles of process optimization within the U.S. regulatory framework for healthcare quality and efficiency? Option A. Focus exclusively on reducing the number of staff involved in the discharge process to lower labor costs, without a comprehensive analysis of how this might impact the quality of care, patient satisfaction, or adherence to regulatory requirements for discharge planning. Option B. Immediately implement a new, automated discharge tracking system based on vendor recommendations, prioritizing speed of implementation to reduce immediate costs, with a plan to address any patient care or compliance issues that may arise post-implementation. Option C. Mandate a reduction in the number of discharge instructions provided to patients to expedite the process, assuming that patients will seek clarification from other sources if needed, without formal process redesign or staff consultation. Option D. Implement a phased approach utilizing Lean Six Sigma principles, focusing on value stream mapping to identify and eliminate waste, followed by a Plan Do Study Act (PDSA) cycle for iterative testing and refinement of solutions, ensuring all changes are evaluated for impact on patient safety, regulatory compliance including HIPAA, and staff workflow. Correct answer is D. Implement a phased approach utilizing Lean Six Sigma principles, focusing on value stream mapping to identify and eliminate waste, followed by a Plan Do Study Act (PDSA) cycle for iterative testing and refinement of solutions, ensuring all changes are evaluated for impact on patient safety, regulatory compliance, including HIPAA, and staff workflow. Explanation: this scenario is professionally challenging because it requires a physician executive to balance the immediate need for efficiency with the long-term implications of process changes on patient care quality and regulatory compliance. The physician executive must not only understand process improvement methodologies, but also apply them within the specific legal and ethical framework governing healthcare in the United States, as dictated by the Physician Executive Certification (CPE) exams jurisdiction. The correct approach represents best professional practice because it prioritizes a systematic, data-driven, and stakeholder-inclusive methodology that aligns with regulatory requirements for patient safety and quality improvement. This approach ensures that changes are evidence-based, sustainable, and do not inadvertently create new risks or violate federal regulations such as the Health Insurance Portability and Accountability Act, HIPAA, concerning patient data privacy, or the Centers for Medicare and Medicaid Services, CMS, conditions of participation related to quality assessment and performance improvement. It also reflects ethical obligations to provide high-quality care and to involve frontline staff in decisions that affect their work and patient outcomes. An incorrect approach that focuses solely on cost reduction without a thorough analysis of impact on patient care or regulatory adherence would be professionally unacceptable. This could lead to violations of the Stark Law or anti-kickback statute if financial incentives drive decisions that compromise patient well-being or lead to improper referrals. Another incorrect approach that bypasses frontline staff input risks alienating the very individuals responsible for implementing changes, potentially leading to resistance, decreased morale, and ultimately, failure of the improvement initiative. This also undermines the ethical principle of shared governance and respect for professional expertise. Furthermore, implementing changes without considering potential impacts on patient data privacy could lead to HIPAA violations, resulting in significant fines and reputational damage. Professional decision-making in such situations requires a structured approach. First, clearly define the problem and desired outcomes using objective data. Second, identify relevant stakeholders, including clinical staff, administrative personnel, and compliance officers. Third, select an appropriate process improvement methodology, e.g., Lean Six Sigma, PDSA, that is adaptable to the healthcare context and aligns with regulatory goals. Fourth, conduct a thorough analysis of current processes, identifying root causes of inefficiency and potential risks. Fifth, develop and pilot proposed solutions, rigorously measuring their impact on efficiency, quality, safety, and compliance. Finally, implement successful changes organization-wide, ensuring ongoing monitoring and continuous improvement, always with an eye toward regulatory adherence and ethical patient care. Question 13. Comparative studies suggest that physician executives often face challenges in aligning patient safety initiatives with organizational resource constraints. when developing new safety and compliance standards, which approach best reflects a proactive and regulatory compliant risk assessment strategy. Option A. Implement new safety protocols based on successful initiatives observed in peer institutions, assuming similar risks exist within the organization. Option B. Focus resources on addressing the most frequently reported patient safety incidents, as these represent the most immediate threats. Option C. Prioritize meeting all mandatory regulatory reporting deadlines and requirements, as this demonstrates a commitment to compliance. Option D. Conduct a comprehensive, data-driven risk assessment to identify potential hazards, analyze their likelihood and impact, and then develop targeted safety and compliance standards based on these findings. The correct answer is D. Conduct a comprehensive, data-driven risk assessment to identify potential hazards, analyze their likelihood and impact, and then develop targeted safety and compliance standards based on these findings. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a physician executive to balance competing priorities, ensuring patient safety through robust risk assessment and compliance with regulatory standards, while also managing resource allocation and operational efficiency. The pressure to demonstrate cost-effectiveness can sometimes conflict with the investment needed for comprehensive safety protocol. A physician executive must navigate these tensions by grounding decisions in evidence-based risk management and a thorough understanding of applicable regulations, rather than solely on financial considerations or anecdotal evidence. Correct approach analysis. The correct approach involves a systematic, data-driven risk assessment process that directly informs the development and implementation of safety and compliance standards. This aligns with the core principles of physician leadership, which mandate a commitment to patient well-being and adherence to regulatory frameworks. By prioritizing the identification, analysis, and mitigation of potential risks, the organization can proactively address vulnerabilities before they lead to adverse events or compliance violations. This proactive stance is not only ethically sound, but also a regulatory imperative, as many healthcare regulations, e.g., those enforced by CMS in the U.S., require organizations to have robust quality improvement and patient safety programs that are informed by risk assessment. This approach ensures that safety standards are evidence-based, targeted, and effective, leading to better patient outcomes and reduced liability. Incorrect approach is analysis. Focusing solely on the most frequently reported incidents without a comprehensive risk assessment is an incorrect approach because it may overlook less frequent but higher severity risks. This reactive strategy can lead to a misallocation of resources, addressing minor issues while neglecting significant potential harms. It fails to meet the proactive requirements of many safety regulations that demand a holistic view of risk. Implementing new safety protocols based on anecdotal evidence from other institutions, without a specific risk assessment tailored to the organization's unique environment, is also an incorrect approach. While benchmarking is valuable, direct adoption, without considering local context, patient population, and existing infrastructure, can lead to ineffective or even counterproductive interventions. This approach lacks the rigor required by regulatory bodies that expect evidence-based practices derived from internal data and analysis. Prioritizing compliance with reporting requirements over the actual identification and mitigation of underlying risks is a flawed strategy. While accurate reporting is crucial, it is a means to an end, not the end itself. Focusing only on the paperwork of compliance without addressing the root causes of potential safety failures can create a false sense of security and leave the organization vulnerable to actual harm and regulatory sanctions for systemic deficiencies. This approach misses the spirit and intent of safety regulations, which are designed to improve care quality and patient outcomes. Professional reasoning. Physician executives should employ a structured risk management framework. This involves 1. Establishing a multidisciplinary team to oversee risk assessment. 2. Defining the scope and methodology for identifying potential risks across all operational areas. 3. Analyzing the likelihood and impact of identified risks. 4. Prioritizing risks based on severity and frequency. 5. Developing and implementing targeted mitigation strategies. 6. Establishing metrics to monitor the effectiveness of these strategies. And 7. Regularly reviewing and updating the risk assessment and associated safety standards. This iterative process ensures that safety and compliance efforts are dynamic, responsive, and aligned with both regulatory expectations and the organization's strategic goals for patient care. Question 14. The risk matrix shows a potential for decreased patient satisfaction scores if the new quality initiative is not met by the clinical team within the next quarter. As a physician executive, you are considering how to motivate the team to achieve these targets. You believe that focusing on the inherent value of improving patient care and providing opportunities for professional development will be most effective. However, a portion of the executive team is advocating for a direct financial bonus tied to achieving the specific satisfaction metric, while another faction suggests implementing public recognition for teams that exceed expectations in a more direct, albeit less public, form of accountability for those who fall short. Option A. Introduce a significant financial bonus for all team members if the patient satisfaction metric is achieved, with no additional incentives or consequences otherwise. Option B. Focus on public commendations for high-performing teams and a system of progressive disciplinary actions for individuals or teams failing to meet the target, communicated through departmental meetings. Option C. Institute a system where individual performance on patient satisfaction surveys directly impacts a portion of each clinician's salary, with immediate financial penalties for any perceived shortfall. Option D. Implement a program that emphasizes professional growth, skill enhancement, and recognition of contributions to patient well-being, while also establishing clear communication channels for feedback and support. Correct answer is D. Implement a program that emphasizes professional growth, skill enhancement, and recognition of contributions to patient well-being, while also establishing clear communication channels for feedback and support. Explanation. This scenario presents a professional challenge for a physician executive due to the inherent conflict between financial incentives and patient well-being, amplified by the pressure to meet organizational performance metrics. The physician executive must navigate this ethical tightrope, ensuring that motivational strategies align with both regulatory compliance and the core tenets of patient care. The challenge lies in applying motivation theories in a way that is both effective for staff engagement and ethically sound, avoiding any practices that could be construed as coercive or detrimental to patient outcomes. Careful judgment is required to select a motivational approach that fosters a culture of quality care and professional integrity. The correct approach represents best professional practice because it prioritizes intrinsic motivation and professional development, aligning with the ethical obligations of a physician executive. By focusing on recognition, autonomy, and opportunities for growth, this strategy fosters a sense of purpose and value among staff, which is a sustainable and ethically sound driver of performance. This approach is consistent with the principles of professional conduct and the physician's duty to promote the welfare of patients, as well as the organizational commitment to high-quality healthcare delivery. It avoids the pitfalls of extrinsic motivators that can lead to unintended negative consequences. An incorrect approach that relies solely on financial bonuses tied to specific, potentially narrow, performance indicators creates a significant ethical failure. This can incentivize staff to prioritize meeting the metric over holistic patient care, potentially leading to a decline in quality or even patient harm. Such a strategy could be seen as a violation of professional ethics by creating a conflict of interest and potentially contravening regulations that mandate patient-centered care. Another incorrect approach that involves public shaming or negative reinforcement for not meeting targets is ethically reprehensible and professionally damaging. This fosters a climate of fear and distrust, undermining morale and potentially leading to burnout and staff turnover. It is a clear violation of professional standards and creates a hostile work environment, which is contrary to any responsible healthcare organization's policies and ethical guidelines. The professional decision-making process for similar situations should involve a thorough assessment of potential ethical implications before implementing any motivational strategy. This includes considering the impact on patient care, staff well-being, and regulatory compliance. A framework that emphasizes a balanced approach, incorporating both intrinsic and carefully considered extrinsic motivators, while always prioritizing patient welfare and ethical conduct, is crucial. Engaging stakeholders, including frontline staff, in the development of motivational strategies can also ensure their relevance and ethical soundness. Question 15. The evaluation methodology shows that a physician executive is reviewing the performance of a new value-based care model implemented across a large U.S. health system. The model aims to improve patient outcomes and reduce overall healthcare costs. Which of the following evaluation approaches best aligns with the principles of value-based care and regulatory expectations for physician executives in this context? Option A. Primary focus on minimizing physician reimbursement rates while ensuring that patient volume remains stable. Option B. A comprehensive assessment that integrates clinical quality metrics, patient-reported outcome measures, and total cost of care data, benchmarked against national standards and internal historical performance. Option C. An exclusive concentration on reducing hospital readmission rates for all patient population, regardless of underlying clinical complexity. Option D. A singular emphasis on improving patient satisfaction survey score across all service lines. The correct answer is B. A comprehensive assessment that integrates clinical quality metrics, patient-reported outcome measures, and total cost of care data, benchmarked against national standards and internal historical performance. Explanation. The evaluation methodology shows a physician executive is tasked with assessing the performance of a newly implemented value-based care (VBC) model within a U.S.-based integrated health system. This scenario is professionally challenging because VBC models, by their nature, shift the focus from volume to value, requiring a nuanced understanding of clinical outcomes, patient experience, and cost-effectiveness. The physician executive must balance the financial viability of the organization with the quality of care delivered, navigating complex data interpretation and stakeholder alignment. Careful judgment is required to ensure the chosen evaluation metrics accurately reflect the model's success and do not inadvertently incentivize suboptimal care. The correct approach represents best professional practice because it prioritizes a comprehensive, multidimensional evaluation that aligns with the core principles of VBC and relevant U.S. healthcare regulations, such as those under the Centers for Medicare and Medicaid Services, CMS, that promote VBC initiatives. This approach demonstrates a commitment to patient well-being, operational efficiency, and regulatory compliance by considering clinical quality measures, patient-reported outcomes, and total cost of care. It reflects a physician executive's responsibility to lead with integrity and evidence-based decision-making, fostering a culture of continuous improvement. An incorrect approach that focuses solely on reducing hospital readmission rates, while a component of VBC fails to capture the full spectrum of value. This narrow focus could lead to providers avoiding complex patients or engaging in practices that improve the readmission metric, but compromise overall patient health or experience, potentially violating ethical obligations and the spirit of VBC. Another incorrect approach that emphasizes only the reduction of physician reimbursement without a corresponding improvement in quality or patient outcomes would be ethically unsound and likely non-compliant with VBC principles, as it prioritizes cost savings over patient value. A third incorrect approach that solely tracks patient satisfaction scores without correlating them to clinical outcomes or cost would also be insufficient, as high satisfaction alone does not guarantee effective or efficient care. Professional reasoning in such situations requires a systematic approach. First, clearly define the objectives of the VBC model and the specific metrics that will measure success against those objectives. Second, consult relevant regulatory guidance, e.g., CMS guidelines for VBC programs to ensure alignment. Third, engage key stakeholders, including physicians, administrators, and patient representatives, to gather input and ensure buy-in. Fourth, utilize a balanced scorecard or similar framework that incorporates clinical quality, patient experience, and financial stewardship. Finally, establish a robust data collection and analysis process to monitor performance and make iterative improvements. Question 16. The efficiency study reveals that implementing a new electronic health record (EHR) system, while projected to significantly reduce administrative overhead in the long term, requires a substantial upfront investment and a temporary increase in nursing staff overtime due to the learning curve. The physician executive must decide whether to proceed with the EHR implementation, delay it, or explore alternative cost-saving measures. Option A. Proceed with the EHR implementation, establishing a dedicated task force comprising clinical staff, IT, and finance to manage the transition, monitor patient care impact, and ensure regulatory compliance throughout the process. Option B. Reject the EHR implementation entirely, opting for a less technologically advanced but cheaper paper-based system to avoid any upfront investment and learning curve challenges. Option C. Delay the EHR implementation indefinitely, citing the immediate financial strain and potential disruption to patient care, and focus on smaller, incremental cost-cutting initiatives across departments. Option D. Proceed with the EHR implementation, but mandate that nursing staff absorb the additional workload without overtime pay to offset the upfront costs, prioritizing immediate financial savings. The correct answer is A. Proceed with the EHR implementation, establishing a dedicated task force comprising clinical staff, IT, and finance to manage the transition, monitor patient care impact, and ensure regulatory compliance throughout the process. Explanation. This scenario presents a common challenge for physician executives, balancing the need for operational efficiency and cost containment with the imperative to maintain high-quality patient care and comply with regulatory mandates. The efficiency study highlights a potential conflict between financial goals and the resources required for optimal clinical outcomes. A physician executive must navigate this by considering not only the immediate financial implications, but also the long-term impact on patient safety, staff morale, and adherence to healthcare regulations. The core challenge lies in making a decision that is financially responsible, ethically sound, and legally compliant, all while supporting the organization's mission. Correct approach prioritizes a comprehensive, data-driven evaluation that integrates financial considerations with clinical quality and regulatory compliance. This involves a multi-stakeholder assessment to understand the full impact of proposed changes. It represents best professional practice because it aligns with the physician executive's fiduciary duty to the organization and its patients, as well as their ethical obligation to uphold professional standards. Specifically, this approach ensures that any decision is informed by an understanding of potential impacts on patient outcomes, staff workload, and adherence to regulations such as those governing patient safety and quality of care, which are paramount in healthcare. An incorrect approach that focuses solely on immediate cost reduction without considering the downstream effects on patient care or regulatory adherence is professionally unacceptable. This could lead to compromised patient safety, increased risk of adverse events, and potential violations of healthcare laws and regulations, such as those related to quality reporting or patient rights. Another incorrect approach that prioritizes maintaining the status quo without exploring potential efficiencies, even if it means foregoing cost savings, can be detrimental to the organization's financial sustainability, potentially impacting its ability to provide care in the long run. This may also be seen as a failure to exercise due diligence in financial stewardship, an approach that relies on anecdotal evidence or personal opinion rather than objective data risks making decisions that are not grounded in reality, leading to unintended negative consequences and a failure to meet organizational objectives. The professional decision-making process for similar situations should involve a structured framework. First, clearly define the problem and the objectives. Second, gather relevant data, including financial, clinical, operational, and regulatory information. Third, identify and evaluate potential solutions, considering their impact on all key stakeholders and compliance requirements. Fourth, consult with relevant experts and stakeholders. Fifth, make a reasoned decision based on the comprehensive evaluation. Finally, implement the decision and monitor its outcomes, making adjustments as necessary. This systematic approach ensures that decisions are well-informed, defensible, and aligned with the organization's strategic goals and ethical responsibilities. Question 17. Operational review demonstrates that our accountable care organization, ACO, is underperforming on key quality metrics related to chronic disease management, despite meeting initial financial performance targets for shared savings. The Finance Committee is advocating for a more aggressive approach to patient attribution and a reduction in certain ancillary services to bolster future shared savings. As the physician executive, what is the most appropriate course of action to ensure long-term success and compliance with Medicare Shared Savings Program, MSSP, regulations? Option A. Implement a revised patient attribution methodology that prioritizes capturing all eligible beneficiaries, regardless of their current engagement with the ACO's care management services, to maximize potential shared savings. Option B. Recommend a significant reduction in the scope of chronic disease management services and limit referrals to external specialists to control costs, thereby improving the ACO's financial performance. Option C. Initiate a comprehensive root cause analysis of the quality metric underperformance, engaging clinical teams to develop targeted care coordination strategies and patient education programs, while also exploring innovative care delivery models that improve outcomes and manage costs effectively. Option D. Focus solely on achieving higher financial performance by reallocating resources away from quality improvement initiatives and towards marketing efforts aimed at attracting healthier patient populations. The correct answer is C. Initiate a comprehensive root cause analysis of the quality metric underperformance, engaging clinical teams to develop targeted care coordination strategies and patient education programs, while also exploring innovative care delivery models that improve outcomes and manage costs effectively. Explanation: this scenario presents a common challenge for physician executives in accountable care organizations, ACO, operating within the U.S. regulatory framework, specifically concerning the Medicare Shared Savings Program, MSSP. The core difficulty lies in balancing the ACO's financial sustainability and performance metrics with the ethical imperative of providing high-quality, patient-centered care, especially when faced with pressure to achieve specific outcomes. The physician executive must navigate complex contractual obligations, regulatory compliance, and the inherent tension between cost containment and clinical judgment. The correct approach emphasizes a data-driven, collaborative strategy that aligns with the MSSP goals of improving care quality and reducing costs. It prioritizes understanding the root causes of performance variations and developing targeted interventions that benefit both patients and the ACO. This approach represents best professional practice because it is grounded in evidence, promotes transparency, and fosters a culture of continuous improvement, all of which are critical for ACO success under CMS regulations. It directly addresses the need to improve patient outcomes and manage costs without compromising care. An incorrect approach that focuses solely on aggressive patient attribution to maximize shared savings, without a corresponding improvement in care coordination or quality, would be ethically problematic and potentially violate MSSP rules regarding patient choice and care management. This could lead to misaligned incentives and a focus on billing rather than patient well-being. Another incorrect approach that involves cutting essential services or restricting patient access to necessary care to meet financial targets would be a clear violation of ethical principles and could jeopardize the ACO's compliance with quality standards and patient access requirements. Such actions undermine the fundamental purpose of an ACO and could result in penalties or exclusion from the program. The professional reasoning process for a physician executive in this situation should involve 1. Thoroughly analyzing performance data to identify specific areas for improvement, not just overall financial outcomes. 2. Engaging with frontline clinicians to understand the practical challenges and opportunities for enhancing care delivery. 3. Consulting relevant MSSP regulations and guidance to ensure all proposed interventions are compliant and aligned with program objectives. 4. Developing a strategic plan that integrates quality improvement initiatives with financial stewardship, ensuring that patient care remains the primary focus. 5. Fostering open communication with stakeholders, including patients, providers, and CMS, regarding performance and improvement strategies. Question 18. Governance review demonstrates that the organization is facing significant financial pressures, necessitating a review of departmental budgets. As a physician executive responsible for a clinical service line, what is the most appropriate approach to budget adjustments to ensure both financial sustainability and the continued delivery of high-quality patient care? Option A. Delegate the entire budget adjustment process for clinical departments to the finance department, trusting their expertise to manage financial constraints effectively. Option B. Rely solely on historical budget data from previous years to inform current budget allocations, assuming past spending patterns accurately reflect current needs. Option C. Implement immediate and across-the-board percentage reductions in all departmental budgets to achieve the required savings quickly and uniformly. Option D. Conduct a thorough impact assessment of proposed budget reductions on patient care quality, access, safety, and staff workload before finalizing any adjustments, and advocate for resource allocation that supports optimal patient outcomes. Correct answer is D. Conduct a thorough impact assessment of proposed budget reductions on patient care quality, access, safety, and staff workload before finalizing any adjustments, and advocate for resource allocation that supports optimal patient outcomes. Explanation. This scenario presents a common challenge for physician executives, balancing the imperative of financial stewardship with the ethical and professional obligation to provide high-quality patient care. The challenge lies in the inherent tension between resource allocation decisions that impact clinical services and the need to meet financial targets. Careful judgment is required to ensure that financial planning does not compromise patient safety or access to necessary care, while still maintaining the organization's financial viability. The correct approach, which involves a comprehensive impact assessment on patient care quality and access before finalizing budget adjustments, represents best professional practice. This aligns with the core ethical principles of beneficence and non-maleficence, as well as the physician executive's responsibility to advocate for patient well-being within the organizational structure. Regulatory frameworks, such as those governing healthcare quality and patient safety, implicitly support this approach by emphasizing the delivery of appropriate and effective care. Furthermore, sound financial planning in healthcare necessitates understanding the downstream effects of budgetary decisions on clinical operations and patient outcomes. An incorrect approach that prioritizes immediate cost savings without considering the impact on patient care quality and access is professionally unacceptable. This failure represents a potential violation of ethical duties to patients and could lead to regulatory scrutiny if it results in compromised care, increased adverse events, or reduced access to essential services. Such an approach demonstrates a lack of understanding of the interconnectedness of financial health and clinical effectiveness. Another incorrect approach, focusing solely on historical budget data without accounting for evolving patient needs or new clinical technologies, is also professionally deficient. This can lead to outdated resource allocation that is no longer aligned with current best practices or patient demographics, potentially hindering the delivery of optimal care and creating inefficiencies. It fails to embrace a forward-looking financial planning strategy essential for a dynamic healthcare environment. Finally, an approach that delegates all budget decisions to non-clinical administrative staff without physician executive oversight or input is problematic. While administrative expertise is crucial, physician leaders are uniquely positioned to understand the clinical implications of financial decisions. Excluding their input risks creating budgets that are financially sound but clinically impractical or detrimental to patient care, thereby failing to uphold the physician executive's fiduciary and ethical responsibilities. The professional decision-making process for similar situations should involve a multi-stakeholder approach. Physician executives must proactively engage in the budgeting process, advocating for resources that support quality care. They should utilize data to demonstrate the link between investments in clinical services and positive patient outcomes, as well as the potential negative consequences of underfunding. When faced with difficult trade-offs, the decision-making framework should prioritize patient well-being, followed by the long-term sustainability of the organization, and then consider operational efficiency. This involves transparent communication with clinical teams and administrative leadership, and a commitment to continuous evaluation of budget impacts on care delivery. Question 19. Risk assessment procedures indicate that a physician executive needs to evaluate the financial performance of a healthcare system to guide decisions on expanding a high-demand service line. Which key financial statement is most critical for understanding the organization's ability to generate revenue and manage its operating expenses over the past fiscal year, thereby informing the financial feasibility of such an expansion? Option A, the statement of changes in equity. Option B, the balance sheet. Option C, the statement of cash flows. Option D, the statement of operations. The correct answer is D, the statement of operations. Explanation. Scenario analysis. A physician executive is tasked with evaluating the financial health of a healthcare organization to inform strategic decisions regarding resource allocation and potential investments. This scenario is professionally challenging because financial statements, while objective, require interpretation within the context of healthcare operations, regulatory compliance, and the organization's mission. Misinterpreting these statements can lead to flawed strategic planning, inefficient resource deployment, and ultimately, compromise patient care and organizational sustainability. The physician executive must balance financial acumen with clinical understanding and ethical responsibilities. Correct approach analysis. The correct approach involves analyzing the statement of operations, also known as the income statement, to understand the organization's revenue generation and expense management over a period. This statement directly reflects the organization's ability to generate surplus or incur deficits, which is crucial for assessing operational efficiency and financial viability. For a physician executive, understanding how clinical services translate into revenue and how operational costs impact profitability is paramount for making informed decisions about service line expansion, cost containment initiatives, and investment in new technologies or personnel. This aligns with the fiduciary duty to ensure the organization's financial health, which underpins its ability to fulfill its mission. Incorrect approaches analysis. Focusing solely on the statement of cash flows would be an incomplete approach. While cash flow is vital for liquidity, it does not provide a comprehensive view of profitability or the underlying operational performance that generates or consumes cash. An organization could have positive cash flow from financing activities while experiencing significant operational losses, which would not be apparent from the cash flow statement alone. This oversight could lead to decisions that improve short-term liquidity but mask long-term financial deterioration, potentially violating principles of sound financial stewardship. Prioritizing the balance sheet without considering the statement of operations would also be insufficient. The balance sheet provides a snapshot of assets, liabilities, and equity at a specific point in time. While it indicates solvency and financial position, it does not explain the performance that led to that position. A physician executive needs to understand the dynamics of revenue and expenses to assess the sustainability of the current financial position and to identify areas for improvement. Relying only on the balance sheet might lead to decisions based on static data, ignoring the operational realities that drive financial outcomes. Analyzing only the statement of changes in equity would be a fundamentally flawed approach. This statement details the changes in the owner's equity over a period, often reflecting net income, dividends, and other equity transactions. While it is a component of financial reporting, it is derived from the performance reported in the statement of operations and does not provide the primary operational insights needed for strategic decision-making by a physician executive. Focusing on this statement would miss the core drivers of financial performance and operational health. Professional reasoning. A physician executive should adopt a holistic approach to financial statement analysis, recognizing that each statement provides a different but interconnected perspective. The statement of operations is foundational for understanding performance and profitability. This should be analyzed in conjunction with the balance sheet for financial position and the statement of cash flows for liquidity. The decision-making process should involve 1. Identifying the key financial questions to be answered. 2. Selecting the appropriate financial statements and metrics to address those questions. 3. Interpreting the data within the context of the healthcare environment and organizational strategy. And 4. Using these insights to inform evidence-based strategic and operational decisions that align with ethical and regulatory obligations. Question 20. The evaluation methodology shows a significant reduction in hospital readmission rates following the implementation of a new post-discharge follow-up program. However, the methodology primarily relies on the readmission rate as the sole indicator of success and does not systematically assess changes in patient adherence to medication, the frequency of reported adverse events post-discharge, or the long-term sustainability of the reduced readmission rate. Which of the following approaches to evaluating this quality improvement initiative best aligns with the principles of comprehensive physician, executive practice, and regulatory expectations for demonstrating meaningful improvement? Option A. Expanding the evaluation to include process measures such as patient engagement in follow-up calls, medication reconciliation audits, and a qualitative assessment of patient understanding of their care plan, alongside continued monitoring of readmission rates and a review of adverse event reporting. Option B. Implementing a retrospective chart review to identify any potential contributing factors to readmissions that may have been overlooked, without altering the current evaluation framework. Option C. Shifting the evaluation focus to patient satisfaction surveys regarding the follow-up program, assuming that satisfied patients are experiencing better outcomes. Option D. Concluding that the initiative is highly successful based on the primary outcome metric and focusing future efforts on scaling the program without further in-depth evaluation. The correct answer is A. Expanding the evaluation to include process measures such as patient engagement in follow-up calls, medication reconciliation audits, and a qualitative assessment of patient understanding of their care plan, alongside continued monitoring of readmission rates and a review of adverse event reporting. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare leadership, where a physician executive must balance the imperative of improving patient outcomes with the practical constraints of resource allocation and the need for robust, evidence-based decision-making. The pressure to demonstrate tangible results from quality improvement initiatives, coupled with the inherent complexities of healthcare systems, requires a nuanced approach that avoids superficial metrics and embraces a thorough, data-driven evaluation. Correct approach analysis. The correct approach represents best professional practice by prioritizing a comprehensive evaluation methodology that aligns with established quality improvement frameworks and regulatory expectations for physician executives. This involves not only measuring the intended outcome, e.g., reduced readmission rates, but also assessing the process changes implemented, the impact on patient safety, and the sustainability of the improvements. This aligns with the principles of continuous quality improvement, CQI, and the physician executive's responsibility to ensure that initiatives are effective, safe, and efficient, as often mandated by regulatory bodies overseeing healthcare quality and physician performance. The focus on both outcome and process metrics, alongside patient safety and sustainability, demonstrates a commitment to a holistic and evidence-based approach to quality. Incorrect approaches analysis. One incorrect approach focuses solely on the primary outcome metric, without considering the underlying processes or potential unintended consequences. This is professionally unacceptable because it risks overlooking systemic issues that contributed to the initial problem or created new ones. It fails to meet the ethical obligation to ensure patient safety and may violate regulatory requirements that demand a thorough understanding of initiative impact beyond a single data point. Such an approach can lead to a false sense of accomplishment, while underlying problems persist or worsen. Another incorrect approach relies on anecdotal evidence and stakeholder satisfaction surveys as the primary evaluation tools. This is professionally unacceptable, as it lacks the objectivity and rigor required for meaningful quality improvement. Anecdotal evidence is prone to bias, and while patient satisfaction is important, it is not a direct measure of clinical quality or safety. Regulatory frameworks and professional standards emphasize the use of reliable, quantifiable data to assess the effectiveness of interventions. Over-reliance on subjective measures can lead to misallocation of resources and a failure to achieve genuine improvements in patient care, potentially exposing the organization to scrutiny for non-compliance with quality reporting mandates. A third incorrect approach prioritizes rapid implementation and visible, albeit potentially superficial, changes over a structured evaluation. This is professionally unacceptable as it bypasses the critical steps of baseline data collection, hypothesis testing, and rigorous outcome measurement. It risks implementing interventions that are not evidence-based, do not address the root cause of the problem, or may even be detrimental to patient care. This approach neglects the physician executive's duty to ensure that quality initiatives are grounded in sound methodology and contribute to meaningful, sustainable improvements, which is often a requirement for accreditation and regulatory compliance. Professional reasoning. Physician executives should employ a structured decision-making process that begins with clearly defining the problem and setting measurable, achievable, relevant, and time-bound, SMART goals for the quality improvement initiative. This involves a thorough literature review and consideration of best practices. The evaluation methodology should be designed concurrently with the initiative, incorporating both process and outcome measures, as well as patient safety indicators. Data collection should be systematic and objective, utilizing validated tools and methods. Regular review of data by a multidisciplinary team is crucial for identifying trends, making necessary adjustments, and ensuring the sustainability of improvements. This iterative process, grounded in evidence and ethical considerations, is essential for fulfilling the physician executive's role in advancing healthcare quality.